This talk is about questioning nursing traditions in the era of evidence-based practice and comes from the work of Dr. Venner Farley. My name is Guy Lemunyan. I started my health career in the Army as a medic during the Vietnam War. I later became an Army nurse. In the civilian sector, I've worked as a technician, staff nurse, charge nurse, head nurse, nurse manager, program manager, and director of nursing. I've also been a nurse educator at 2 community colleges, 3 universities, and 2 private educational institutions. Dr. Farley was the Dean of Health Professions at Golden West College in California after her work in Long Beach Community College. She also is a national, international presenter and sought after speaking during her lifetime. Dr. Farley had 4 major publications that are still in print today. I heard Dr. Farley speak at St. Joseph Hospital during a Nursing Week celebration. And here are a couple of questions she asked. She said, "Do you double check the dosages of insulin before giving them in this hospital?" And all nurses' heads went, yes, affirmative. Then she asked, "Do you give any drugs that are more harmful than insulin? For example, chemotherapy agents?" And nurses started to look at each other and still shaking yes. The other thing she asked was, "Are you aware that there are much more effective agents for skin preparation before injection than alcohol?" So it turns out, and the initial research done in 1969, that there's no statistically significant difference in skin reactions or infection rates in comparing alcohol cleansing versus no cleansing at all. And there's a significant increase in pain because of, carrying wet alcohol into the tissue. Actually, the World Health Organization recommends 30 seconds dry time before injection. I have seen many nurses use gauze to dry the area before injecting. And now about the double checking of medications. So this is a literature review, and there's really no evidence that it cuts down medication errors, and even into hanging blood for transfusion. There's really not much evidence as yet that that prevents hanging the wrong blood. I would like to check my blood with another nurse before I hang it, however, because the results of hanging the wrong blood type can be disastrous. Other research interests of mine are the effectiveness of nursing care plans. Is there any proof that they save lives, prevent complications, or shorten hospital stays? I'm also interested in the ADPI process that we teach as nursing process in nursing school. Does that save lives, prevent complications, or shorten hospital stays? I can't find any evidence that it does. And lastly, about nursing diagnosis. Does the use of nursing diagnosis save lives, prevent complications, or shorten hospital stays? I have one other survey done here that shows that nurses do not feel that nursing diagnosis is very helpful, and that care plans are just taking an awful lot of their time, and they don't use the care plans anyway. So, in the end, thank you, Dr. Farley, for teaching me how to question nursing traditions. I hope you enjoyed my presentation. Thank you for listening.